Good morning, everybody. I am Victoria Lancy, the Rural Education Manager from Michigan Center for Rural Health, and would like to welcome everyone to today's Macro MIPS and APMs education series. Our topic this month is understanding virtual agreements and MIPS APMs. If you are logged into the webinar portion, you can listen to the link provided, and if you are participating via phone, do not worry, we're recording each webinar, and the recording will be posted on the MCRH website. Click on www.mcrh.msu.edu. Click on the resources tab across the top, then click on the QPP dropdown. If you would like to ask a question, you can type it into the chat feature, or you can ask it during the Q&A portion at the end of the webinar, when all lines are unmuted. With that, I would like to introduce our speakers from Hall, Bender, Killian, Heath, and Lyman. Our first speaker is Lisa Lusudo, and then our next presenter will be Brian Bauer. Go ahead and take it away.
Thank you so much, Victoria. Good morning, everyone, and thank you for joining us for part 7 of our Macro MIPS webinar series. So today, as Victoria mentioned, we are going to provide you with a high-level understanding of MIPS virtual groups and MIPS APMs. So we'll start out by just setting forth some background for you and giving you a general overview of what are virtual groups. We'll also discuss what it means to participate as a virtual group in the MIPS program. We'll discuss in some greater detail some of the requirements associated with participating as a virtual group in MIPS, including virtual group formal agreements and those requirements. And then we'll transition to talk about MIPS APMs, which is another way that you may participate in the MIPS program. And we'll also discuss what it means to participate in MIPS as a MIPS APM. So as a reminder for everybody, and if you're just joining us for part 7 today, the MIPS program for 2018 is comprised of 4 different performance categories where you can earn a total of 100 possible final score points, and your score will ultimately determine whether you'll receive a positive, negative, or neutral payment adjustment to your Medicare Part B professional payments. So our prior webinars talked about each of these 4 categories in some greater detail. Today we'll talk about some unique ways that you can participate in MIPS and how that may impact these 4 performance categories. So this slide may be familiar to some of you that have been participating in our prior webinar series, but for those of you who are just joining us, we will give you a general overview of how you can participate in MIPS. So you may participate as an individual under your National Provider Identifier, otherwise known as your NPI, and your tax ID number, where you reassign your benefits for Part B physician professional payments. You may also participate in MIPS as a group. Under the definition that CMS has provided for the MIPS program, a group is defined as 2 or more clinicians based on your NPI who have reassigned their billing rights to a single tax ID. An APM entity is also considered a group. And the focus of our presentation today is the virtual group model. So you can participate in MIPS as a virtual group, and this concept is new to the 2018 reporting year. And as a virtual group, a virtual group is defined by CMS as a group of solo practitioners and groups of 10 or fewer eligible clinicians who come together virtually. So it doesn't matter where you are physically located or what specialty you may practice in, you are able to come together and form this virtual group model regardless of physical location or specialty to participate in MIPS for a given performance year. And so what's important to note is if you do choose to participate in MIPS as a group or a virtual group, you will be assessed on those 4 performance categories from the prior slide as a group. So what exactly is a virtual group? As I mentioned before, a virtual group is defined as a combination of 2 or more tax ID or TINs assigned to 1 or more solo practitioners or to 1 or more groups consisting of 10 or fewer eligible clinicians. So If you are a group that wants to join a virtual group, your group has to consist of 10 or fewer clinicians. At least one of those clinicians must be MIPS eligible, or both that elect to form a virtual group for a given performance year. A group is considered to be an entire single tax ID that elects to participate in MIPS as part of a virtual group. So again, as I mentioned, you are assessed based on your entire virtual group. So who can participate in a virtual group? As I mentioned on the prior slides, you can either participate as a solo practitioner or as a group. If you choose to participate as a solo practitioner, there are certain requirements that have to be met. So first, you have to be a MIPS eligible clinician. You have to exceed the low volume threshold, which we'll talk about in the next few slides. You cannot be a newly enrolled Medicare MIPS eligible clinician, so you can't be new to the Medicare program. You also can't be a qualifying APM participant, otherwise known as a QP, or a partial QP choosing not to participate in MIPS. If you choose to participate as a group, again, your group has to have 10 or fewer clinicians and exceed the low volume threshold at the group level. Tax ID enrolled MIPS eligible clinicians, clinicians with QP status, or clinicians based on the number of MPIs billing under a TIN is how a group is defined, and this includes MIPS eligible clinicians. Clinicians who don't meet the definition of a MIPS eligible clinician are excluded from MIPS participation. So again, you need to make sure that you are not excluded from participation. As I mentioned, you can't be, an example of that is a newly enrolled Medicare clinician or a clinician with partial QP status choosing not to participate in MIPS. So it's important to know that a solo practitioner or a group can only participate in one virtual group during a performance period. There are no limits on the number of solo practitioners and groups able to form or join a virtual group. So there could be no maximum number of solo practitioners that come together to form a virtual group, and there is no ceiling or cap that CMS has set forth for groups to join a virtual group. If a group chooses to join a virtual group, all of the clinicians in that group are part of the virtual group. So certain clinicians in a group can't elect or decide to self-select themselves out of the virtual group. So it's all or nothing. If your group chooses to join the virtual group, all clinicians are automatically a part of the virtual group. Virtual groups have the flexibility to determine their own composition, so they can decide who's in and who's out. And there, again, as I mentioned prior, there are no restrictions based on location, specialty, or other factors. So this gives a lot of clinicians and others that are interested in participation a lot of flexibility. You don't need to be physically located even in the same city or same state. And you also don't need to be practicing the same type of specialty medicine in order to form a virtual group. So this may help a lot of MIPS eligible clinicians achieve maximum points by joining a virtual group model. So this slide details who is included and eligible to participate in a virtual group based on the low volume threshold. So the low volume threshold changed from transition year 2017 to 2018. So as you can see, MIPS eligible clinicians are included and able to participate in a virtual group if they bill more than $90,000 a year in Medicare Part B allowed charges, and if you provide care for more than 200 Medicare patients per year. So it's very important that you are aware of this low volume threshold so you can determine if you would be eligible to participate in a virtual group. And again, both elements would need to be met, which is billing greater than $90,000 for your Part B charges, and you see more than 200 Medicare patients per year. And this slide details who is excluded. So I mentioned previously, if you're newly enrolled in the Medicare program, you're going to be exempt from MIPS and you wouldn't be able to participate in MIPS as a virtual group. If you are below the low volume threshold requirements, you are also not eligible to participate in MIPS as a virtual group. So again, here you cannot participate in MIPS as a virtual group if your Medicare Part B allowed charges are less than or equal to $90,000 a year, or if you see 200 fewer Medicare Part B beneficiaries per year. Again, also, you also cannot participate in a virtual group if you are significantly participating in an advanced APM model. So these are the three types of categories of clinicians or groups that would not be eligible to participate as a virtual group. So why join or form a virtual group? What are the benefits? CMS believes that the formation of virtual groups provides for a comprehensive measurement of performance, shared responsibility, and an opportunity to effectively and efficiently coordinate resources to achieve requirements under each performance category. A solo practitioner group may elect to join a virtual group in order to potentially increase their performance under MIPS. So if you're a solo practitioner group that would otherwise perhaps have some operational challenges, given a lack of resources or ability to maximize points under the MIPS program, this might be a good alternative way for you to consider participating in MIPS, and it might afford you more benefits joining a virtual group and being able to maximize your points this way. So the next few slides will talk about how to participate in MIPS as a virtual group. So for this year, for 2018, you would have already had to elect your status as a virtual group by December 31st, 2017. So that date has passed. So for purposes of this webinar today, we'll talk about how you can participate as a virtual group for the next performance period for 2019. So the virtual group election period opened just at the beginning of this month on October 1, 2018, and it will close on December 31st, 2018. So you have a few months here to evaluate and analyze whether it might be beneficial to you to elect to participate in MIPS for next year as a virtual group. In order to participate in MIPS as a virtual group, an election must be made prior to the start of the performance period and can't be changed once the performance period begins. But it's important to note that an election can be changed at any time before the virtual group election period closes on December 31st, 2018. So you'll have a couple months to think about whether or not it may make sense for you as a solo practitioner or make sense for your group to participate in MIPS next year as a virtual group. And you can make changes and updates anytime up until December 31st, 2018. Once that deadline has passed, you're either locked in as performing as a virtual group or not. So it's very important that you take some time over the next few months to consider whether or not this makes sense for you and get your elections in prior to the deadline. So when you participate as a virtual groups in MIPS, you're required to aggregate all of your data across tax IDs within the virtual group for all 4 MIPS performance categories. So you are essentially measured and scored based on performance of all of the other solo practitioners and groups within your virtual group. Each member of a virtual group will have their performance assessed and scored at the virtual group level, again, across all 4 MIPS performance categories. A whole TIN or tax ID participates in a virtual group, meaning that each clinician, based on their individual MPI, under a tax ID is a member of a virtual group. Each clinician within the virtual group will have a final score based on the virtual group's performance, but only clinicians who are eligible for MIPS would receive a MIPS payment adjustment. Any MIPS eligible clinician who is part of a tax ID participating in a virtual group and is also participating in a MIPS APM or an advanced APM, which we'll talk about in the next few slides a little later in our presentation. So if you are participating as a virtual group, but you're also participating in a MIPS APM or an advanced APM under the APM scoring standard, you will not earn a MIPS payment adjustment based on the virtual group's final score. But you would earn a payment adjustment based on the APM scoring standard. And again, I'll provide a little bit more background and understanding of scoring if you are participating as a MIPS APM or an advanced APM a little bit later in our presentation. So in general, participating MIPS as a group and as a virtual group, the policy application is generally the same in terms of how you submit data and the performance category requirements, but there are just a few exceptions. So you will have the same submission mechanisms available to you if you choose to participate in MIPS as a virtual group, and the same performance category requirements. Requirements pertaining to calculation of measures and activities when reporting via QCDR, a qualified registry, or EHR and attestation do differ. Such requirements apply cumulatively across all tax IDs in the virtual group. Virtual groups aggregate data for each MPI under each tax ID and will report one measure at the virtual group level. And there are a few policies that I'll talk about that differ at the group level versus the virtual group level. The first being non-patient facing status. So for virtual groups, a virtual group is considered to be non-patient facing if more than 75% of MPIs billing under the virtual group's TINs meet the definition of a non-patient facing individual MIPS eligible clinician during the non-patient facing determination period. And virtual groups will be determined to be non-patient facing, have the advantage of their advancing care information performance category automatically reweighted at 0. Another slight difference is rural area and HIPSA status. A virtual group will be designated as a rural area or health professional shortage area, otherwise known as HIPSA practice, if more than 75% of MPIs billing under the virtual group's tax IDs are designated in a zip code as a rural area or HIPSA. The last policy we will talk about is small practice status. So a virtual group will have a small practice status if the virtual group has 15 or fewer eligible clinicians. Small practice status is applied based on the collective entity as a whole, and it's not based on the small practice status of each tax ID within the virtual group. So that's important to know, that it's not assessed at each individual tax ID group level. It will be assessed based on the collective entity as a whole. If a virtual group has 16 or more clinicians, it would not be considered to have small practice status as a collective whole. So how do you go about electing virtual group status if this is something that is of interest to you for calendar year 2019? CMS has established a two-stage election process for virtual groups. The first stage is optional and the second stage is required. So for stage 1, solo practitioners or groups with 10 or fewer clinicians can contact their local quality payment program technical assistance organization to see if you are eligible to join or form a virtual group prior to submitting an election. So if you're not entirely sure that you meet all of the requirements to join a virtual group, CMS does have resources available to you, and you can reach out to the Quality Payment Program Technical Assistance Organization to help guide you through that process to see if the election even makes sense before you expel a ton of resources and time and money into determining whether virtual group status is right for you. Otherwise, if you've already done your due diligence on your end and you're confident that you're able to meet the virtual group requirements, then you can advance to stage 2. So for groups that don't participate in stage 1 of the election process, CMS will determine your eligibility to form a virtual group upon submission of a virtual group election to CMS via email. So we'll go into some greater detail about the stage 2 election process. So for stage 2 election, each virtual group must have a formal written agreement. The written formal agreement does not need to be submitted to CMS, and there are sample agreements available in the virtual group toolkit that CMS has available on its quality payment website. Additionally, you will need to name an official virtual group representative and submit the virtual group's election by the election submission deadline. So for 2019, that deadline is this December 31st. You'll also need to determine the group size and low volume threshold to make sure that you meet eligibility criteria. Again, as I mentioned, virtual group election must be made by December 31st, 2018, and it must include the following information. It must include information about each TIN and MPI associated with the virtual group. So you'll need the tax ID and legal business name that's recorded in your Medicare PCOS profile for each tax ID. For a TIN, that's a social security number of a clinician. It's important to know that you only include the last 6 digits of the social security number of that individual clinician when submitting an election to CMS. You'll also need to include the name and MPI of the clinicians associated with each tax ID. Additionally, you'll need to include the office virtual group representative's name, tax ID, practice affiliation, and contact information. You'll also need to acknowledge that a formal written agreement has been established between each solo practitioner and group that composes the entire virtual group. Again, formal written agreements do not need to be submitted to CMS as part of the group election, but you do need to ensure that they are in place. And we'll talk about the formal written agreement requirements and what elements must be included in the next few slides. If a virtual group meets the eligibility criteria for forming a virtual group, CMS will contact the virtual group's official representative via email and give the virtual group an identifier for performance in early 2019. Each member of a virtual group will be identified by a unique virtual group identifier made up of the following information: the virtual group identifier established by CMS, a unique tax ID, and MPI. So now we'll talk about what's required to be in a virtual group agreement, which is an integral part of the election process. A virtual group must have a formal written agreement between each solo practitioner and group that composes the virtual group to ensure that the requirements and expectations of participation in MIPS are clearly articulated, understood, and agreed upon. As part of the election process, each virtual group's official representative will confirm that an agreement for at least one performance period has been established between each solo practitioner and group that composes the virtual group. So there are certain elements that the formal written agreement must contain. The first element is that the agreement must identify the parties to the agreement by the name of the party, tax ID, and MPI, and include as the parties to the agreement only the groups and solo practitioners that compose the virtual group. The agreement must be executed on behalf of each party by an individual who is authorized to bind the party. So it's really important that you ensure that the appropriate person is signing the virtual group agreement. Additionally, the formal written agreement must expressly require each member of the virtual group to participate in MIPS as a virtual group and comply with the requirements of MIPS and all other applicable laws and regulations. Further, each virtual group agreement must identify each MPI under each tax ID in the virtual group and require each tax ID within a virtual group to notify all MPIs associated with the tax ID of their participation in MIPS as a virtual group. The virtual group agreement must also set forth the MPI's rights and obligations in and representation by the virtual group, including without limitation the reporting requirements and how to participate in MIPS as a virtual group affects the ability of the MPI to participate in MIPS outside the virtual group. The virtual group agreement should also describe how the opportunity to receive payment adjustments will encourage each member of the virtual group to adhere to the quality assurance and improvement goals of the group. Additionally, the agreement must require each party to update its Medicare enrollment information. So in the event that an MPI is added or deleted through a tax ID, the Medicare guidelines will require you to notify the virtual group of any such changes within 30 days. So it's important that language is built into the virtual group agreement as well. The virtual group agreement must be for a term of at least one MIPS performance period. Additionally, the virtual group agreement will need to require completion of a closeout process upon termination or expiration of the agreement. So each party to the virtual group agreement will need to furnish all the data necessary in order for the virtual group to aggregate data across the virtual group. As a reminder, if an MPI joiner leaves the tax ID or a change is made to a tax ID that impacts the agreement itself, so if there's a legal business name change, for example, during a performance year, A virtual group has to update the agreement and send the changes to CMS via its Quality Payment Program Service Center. So now we'll transition and spend a few minutes talking about participating in MIPS as a MIPS APM. So just by way of some background, under MACRA, you can choose to participate in the CMS Quality Payment Program through two different tracks. The first being MIPS, which we focused on throughout the past webinars, or you can also participate in CMS QPP through an advanced alternative payment model. Importantly, advanced alternative payment models are excluded from MIPS reporting requirements and payment adjustments. But this is not to be confused with MIPS APMs, which are not excluded from MIPS. MIPS APMs include MIPS-eligible clinicians as participants and hold their participants accountable for the cost and quality of care provided to Medicare beneficiaries. MIPS APMs are scored based on a special scoring standard, which is known as the APM scoring standard, and it's designed to account for activities that are already required by the APM. So this special scoring standard is designed to eliminate any overlap in the requirements that the MIPS program may require and any requirements that participating in the APM may require. So as a general overview of APMs, I think it's just important to set the background here and remind ourselves what is an APM and how do MIPS APMs fit into this model. So advanced APMs and MIPS APMs, as you can see in the graphic, are subsets of advanced alternative payment models. Advanced alternative payment models are a payment approach that provides added incentives to clinicians to provide high quality and cost-effective care. Advanced payment models can apply to one specific condition, care episode, or population, and may offer significant opportunities for clinicians who are not ready to participate in advanced alternative payment models. So APMs are the broad category, and MIPS APMs and advanced APMs are a subset of APMs. So there are three specific criteria that set forth the elements of what exactly is a MIPS APM. So the first is the APM entities that participate in the APM under agreement with CMS. So the APM entity must have an agreement with CMS in order to qualify as a MIPS APM. The APM must also require that APM entities include at least one MIPS clinician on a participation list. And the APM must base payment incentives on performance, either at the APM entity or clinician level, on cost, utilization, and quality measures. So this graphic sets forth the different categories of APMs and the potential financial awards associated with participating in each category. So if you're not in an APM, you are just subject to normal MIPS reporting adjustments, assuming that you are eligible to participate in MIPS and you're not excluded from the MIPS program. If you are participating in an APM in the CMS Quality Payment Program, you're subject to MIPS adjustments and APM-specific rewards. If you're participating in a MIPS APM, you're subject to that special APM scoring standard, which counts towards your MIPS Part B payment adjustments, and you're also eligible to receive APM-specific rewards. Advanced alternative payment models are excluded from participating in MIPS. Will receive MIPS APM-specific rewards, and if you're in a qualifying APM participant or QP status, you're also eligible for a 5% lump sum bonus. Some examples of MIPS APMs are set forth on this slide. A lot of you may be familiar with or are already participating in an MSSP ACO under Track 1, Track 2, or Track 3, so that would be an example of a MIPS APM. The Medicare ACO Track 1 Plus model is also included, and the Next Gen ACO model, and then there are a few others that are also included as an example of what a MIPS APM is. Again, what's interesting is that most advanced APMs are also considered MIPS APMs. So eligible clinicians participating in the advanced alternative payment model that do not meet the threshold for sufficient payments or patients through an advanced APM in order to become a qualifying APM participant will be scored under MIPS according to the APM scoring standard. The APM scoring standard is designed to account for activities that are already required for the APM. And the goal of the APM scoring standard is to reduce the burden of participants by eliminating the need to report both the APM and MIPS. So eliminates the need for you, if you're participating in both, to double report your data. And using the APM scoring standard, one final score for the APM entity is calculated and applied to all eligible clinicians within the APM entity. Eligible clinicians in MIPS APMs are not eligible for the annual advanced alternative payment model 5% lump sum bonus payment. However, eligible clinicians may qualify for positive MIPS payment adjustments and an exceptional performance adjustment based on the APM entity final score. So if you are in a MIPS APM, you can get the benefit of potentially a positive MIPS payment adjustment, exceptional performance adjustments based on the APM entity's final score. So opportunities for maximizing points under both categories. Under the APM scoring standard, eligible clinicians are subject to the MIPS reporting requirements and payment adjustments. And to ease the reporting burden for the quality performance category, CMS will use the APM quality data submitted by the MIPS APM on behalf of the participating MIPS eligible clinicians. So you won't need to report your quality data twice. CMS will just pull that data from the APM quality data in order to determine your MIPS score. MIPS APMs are only required to self-report the promoting interoperability performance category under MIPS, as the other categories are not subject to reporting requirements, or CMS will draw data from other sources. So the benefit of participating MIPS as a MIPS APM is that you have less reporting obligations, as CMS will already have that data by virtue of you participating in the MIPS APM. So the promoting interoperability performance category is the only category that you're required to self-report under MIPS. The advancing care information performance category will require data submissions from the participating APM tax ID number. And the tax ID scores will then be aggregated as a weighted average based on the number of eligible clinicians in each tax ID to produce a single APM entity group score for the advancing care information performance category. So under the APM scoring standard, if you are a MIPS APM, the performance category weights used to calculate the MIPS final score under the APM scoring standard for 2018 are as follows. So first, for quality, it's weighted at 50%. Cost is weighted at 0. Improvement activities are weighted at 20%, and promoting interoperability is weighted at 30. And that wraps up our presentation for today. Our next webinar will discuss the Advancing Care Information Category Reporting Requirements. In December, we'll talk about understanding the requirements of quality category reporting. January, we'll discuss and review improvement activities category reporting. February, we'll talk about some last-minute reporting issues and developing strategies for the cost category as we're getting to that March deadline. And then in March, we'll do a comprehensive review of the MIPS program and discuss some future considerations for the 2019 reporting year. If you have any questions following this webinar, please feel free to reach out to me or Brian Bauer. Both of our contact information is available here on the slide for your reference. Thank you everyone so much for joining us this morning.